Hi, everyone. Welcome to the One Podcast, Oncology Nutrition Experts. I'm Hillary Sachs, registered dietitian and board certified specialist in oncology nutrition. And I'm here with my colleague, and I'll let her introduce herself.
Hi, everyone. I'm Dr. Christina Tito Mihalakis. I'm also a board certified specialist in oncology nutrition. The registered dietitian is a given. I'm a professor of nutrition and dietetics. I'm a certified personal trainer and a certified cancer exercise specialist. And that's actually what we're going to be talking about a lot today.
Yeah, today we're going to be focusing on physical activity, movements, and basically throughout the cancer continuum,
Yeah.
both during treatment, prevention, all the things.
Absolutely. Yeah. And we're also going to talk about how different movement can look between those different stages in the cancer continuum. So, whether it's diagnosis, treatment, maybe after surgery, or for long term survivorship.
Yeah. Have you worked with a lot of cancer survivors in terms of physical activity with your degree?
As a personal trainer, I did. However, I also partner with PT and OT
Yeah.
because it's such a vulnerable kind of position to be in, especially for patients, and specifically right after surgery. Dietitians and personal trainers, like our scope of practice is not to completely do physical activity and to take over the physical activity portion or the movement portion, but we can give general recommendations, which we're going to go through. Maybe we'll start with like the before treatment and move through. I'm sure we both have a few examples that we can give.
Yeah, sounds good. Yeah, no,
What
I'm
about
interested to
you?
hear your perspective with the personal training backgrounds. And, as you mentioned, just like after certain surgeries, both in
Yeah.
terms of healing properly, I always like to get like guidance on what kind of movement is safe, or even just getting people confidence in jumping back into moving.
Yeah.
So yeah.
I would say in terms of like the physical activity, the before and the after, like, when they're cleared to do full physical activity is where the personal training comes in.
Yeah.
Um, but during, that's where I'm a little bit more cautious and much more collaborative.
Yeah. Yeah. Makes sense.
Yeah.
Makes sense. Yeah.
So let's talk about benefits first. What do you usually tell the people who you work with?
Oh my goodness. There are so many studies showing the benefits of movements. And I say movements instead of, going to the gym, because it literally means movements.
Yeah.
We were having a conversation earlier about studies that show that just moving more throughout the day lowers risk. There are so many studies that show that, you know, doing short bursts of movement throughout the day is super meaningful. And I oftentimes tell my clients to think about, people in Europe who are just walking more throughout the day. They aren't necessarily going to the gym, but they're just moving their bodies more. And that counts. That counts so much. So whether it's standing at your desk, whether it's walking to the further bathroom at work, whether it's doing a lap around your place of work before going in and before leaving. All those little bits really do count. It doesn't have to be intense sweating and muscle building. Like those things make a big difference.
That's exactly what I say too. I'm like, movement does not have to be you going to the gym and walking on your hands in a handstand. It can be walking your dog, playing with your kids. That's movement. Taking care of kids.
Yeah.
That's activity.
That's a lot of movement.
That's certainly activity. Cleaning the house. Have you ever started a goal, no matter what stage they're at, as just like stepping outside?
Yeah, yeah. Just even getting that morning sunlight and being outside and getting the fresh air has impact on circadian rhythm and hormone balance.
Absolutely.
So, yeah, we're just here in the Northeast, we're just moving into spring. So, I'm so looking forward to feeling warmer air as I step outside.
Yeah.
But yeah, it can just make a difference in terms of ability to focus, mental outlook. And then literally how hormones are released in your body. People sleep
Absolutely.
better just by getting a little bit of sunlight every day.
Yep. I believe the recommendation is to get some sunlight 30 to 60 minutes within waking up.
Mhm.
So, yeah, I often tell the people who I work with, step outside. If that means a walk, then it's a walk, but let's just start with stepping outside, getting some fresh air, and looking up, right? Like, how often do we forget to just look up from a phone, from a book, from a table, wherever we are? Look at nature. I have a colleague who actually studies, the relationship between health and food choices and being in nature. And
Interesting.
it is so beneficial to even look at nature, even if it's a photo.
Yeah. Yeah. Pretty
So,
cool.
but in terms of movement, yeah, that's kind of like the stepping stone. Like I often say, why don't we just start with stepping outside, get some fresh air, get some sunlight, and then if that leads to a walk, even better.
Yeah.
Because we know that that decreases cancer-related fatigue, it increases insulin sensitivity, and then of course, as time goes on, and if it's appropriate, we want to go into those activities that increase lean body mass, because that's what we're really concerned with.
Yeah. Yeah. And lean body mass is that muscle that we know can get
Yeah.
depleted so quickly and easily. So anything we could do to just keep those muscles active is so helpful. And I like that you mentioned insulin sensitivity, which is just like a fancy name for how well our bodies are taking the sugar out of our blood and bringing it into our cells where it belongs. So many times with treatments, both between stress, which could increase people's blood sugar,
For
and
sure.
steroids, which are a very common part of treatments to prevent reactions, blood sugar can go up. And one of the interventions that I speak with people about very commonly is just 5 minutes after eating, even if you're just sitting down and moving your arms and legs while sitting, that can help lower your blood sugar. And it's amazing what a difference it makes.
Absolutely. Yeah. And coming from like the inpatient side of things too, something that we
Yeah.
often recommend even after surgery is movement for a lot of different reasons that we'll get into.
Okay.
But it's because they often say like, oh, my blood sugars are high. And after surgery, that's a whole nother topic. But
Yeah.
they say my blood sugars are high. I can't eat carbohydrates. And that we always say your body needs those carbohydrates, especially when you're recovering. Why don't we try walking on the unit? Why don't we try walking on the floor after you eat something, both for, blood glucose or blood sugar, however that can help, but also because it helps to move things along on the inside too.
Yeah. And that's a good point. So there's so many benefits to exercise and movement. Um, some of which include, sorry, I just lost my train of thought. Sorry about that. Um, there's so many benefits to movement during treatment. There's countless studies on how it can reduce treatment related side effects. But one side effect that also is very common is constipation. A lot
For
of the
sure.
anti-nausea medications, which work so well and we're so grateful for, have constipation as a side effect. And we often think of fiber and fruits and vegetables as an intervention, but moving your body helps to increase something called peristalsis, which is the movement of fecal matter throughout your digestive system so that it can pass more easily. So that's really important during treatment, but also just in terms of prevention, we know that our bodies detoxify through releasing toxins and bowel movements. So if we're getting regular bowel movements, that's one way for preventing different diseases like cancer.
Absolutely. Absolutely. Let's talk a little bit more about movement during treatment. I know we touched on surgery or right after surgery, but what about like chemotherapies and immunotherapies? Like, what are your recommendations to people who are going through like systemic treatment or those chemotherapy treatments and movement?
Well, right now, the recommendations really do show that moving even throughout therapy is very beneficial and can minimize side effects. I always defer and say, make sure you're cleared for movement with your doctor, just to
Absolutely.
make sure in case there's anything else going on that I'm not privy to. And, if you're prone to low blood pressure and you get dizzy when standing, just make sure you're doing it carefully. The health system that I work with also does offer physical therapy meant for people going through treatments. And privately in my practice, I have a few practices that I coordinate with that specifically are oncology based. So having someone who really is an expert in what you're going through and what's safe and what's not is very, very helpful. But movement, even throughout treatment, is key.
I think that's a really important point because I often refer the people who I work with to different professionals, also
Mhm.
depending on cancer type. And the surgery that they just had. For example, the
True.
same person who may work with someone after a GI surgery might not work with another professional who specializes in someone who just had like breast reconstructive surgery or something like that, because it's different. They can specialize, like especially physical therapists, they can work with both. But I think just like dietitians, we all have our specialties.
Yeah, yeah, and that's a great point because certain types of surgeries, like breast surgery, can involve the lymphatic system. So having someone who specializes in movement specifically for lymphedema prevention, which is puffiness that comes sometimes post-surgery because of the lymphatic system being disrupted, is really, really helpful. And many times, just the nature of the surgery, range of motion is restricted, and you don't want to do certain types of motion, which could irritate the lymphatic system. So, having a lymphedema specialist for exercise could be really, really important.
Absolutely. Yeah, that's a great example. Like we know if women have just undergone like breast reconstructive surgery, that like chest flies are off the table for quite some time.
Yeah,
And actually upper body in general. But we do want some movement to also break up that scar tissue.
yeah, yeah. So,
Yeah.
figuring out what that means and what that is.
Yeah, absolutely. And what they're cleared for. Again,
Mm-hmm.
interdisciplinary collaboration
Yeah,
for sure.
yeah.
And
Mm-hmm.
gradual progression. We're not going to go from surgery to doing push-ups in a day.
Yeah,
That's not going to happen.
yeah.
But let's talk about other light movements that you recommend. Let's kind of, I don't know, popcorn here. What's like a go-to movement that you tell your clients to do?
Well, I mentioned even just moving your arms and legs every 5 minutes or getting up during commercials, setting an alarm in every hour, just getting up and doing a lap around, I find really helpful. I know you mentioned cleaning your house, which
Yeah.
I sometimes will put in earphones and listen to an audiobook or a podcast like this. And that sometimes is motivating. And like, I want to keep going because I want to keep listening. And you get warm, you work up a little sweat while doing it and don't even realize. So anything counts, really. I mean, it's cliche to say this at this point, but parking further, every little bit
Yeah.
really does count.
Absolutely. I've had so much success with clients now, kind of talking about the survivorship kind of stage where they had surgery. Maybe they were on like some hormone therapies, they gained weight. And of course, many people may come to us and say, I want to lose weight. That's my goal, because that's understandable. There's this fear of having cancer again because of weight. And that's a whole nother discussion that we can have. And we've spoken about this before, but what we emphasize and what we're aligned with is really encouraging those healthy behaviors.
Mm-hmm.
So I say, forget the number on the scale. Let's focus on behaviors. And one of those behaviors, like you're saying, is movement. And I think people often think of like structured, scheduled, super intentional movement. And to your point, it can be standing because maybe you're folding laundry, and instead of sitting, you stand,
Yep.
if that's possible. It could be cleaning your house because, let's be honest, vacuuming, mopping, sweeping, like that is definitely an activity. And also, I often encourage people to shift the intention. So instead of saying, I have to really be deliberate in going to the gym. I say be deliberate in how you lift things in the house. Incorporate more of your leg muscles. So if you're bending down to get a garbage bag, do it as more of a squat as opposed to bending from the waist. So you're incorporating more of the leg muscles.
I love that.
Yeah, small changes make a big difference in the long run. Um, I mean, I'm looking at my dogs right now because we're recording this in a house, but I'm like, giving my dog a bath is a workout.
Oh my God.
I'm like, that's
Oh.
activity right there.
Mhm.
So there are a lot of things that count as movement. The stairs.
Yeah, yeah. Going up and down stairs is a big thing. I think one thing that people oftentimes they say to me is like, I'm so tired. I don't have it in me to exercise or move. But again, it's kind of a different way of thinking about it. But there are studies showing that fatigue goes down when you move. And that doesn't mean moving yourself to exhaustion. That just means moving more and getting your blood flowing and taking breaks when you need to. How do
Yeah.
you feel about activity trackers like the bracelets that keep track of your steps?
Oh, oh. I mean, you know my style. I'm like, let's move away from tracking. Let's move into seeing how your body feels more. But
Yeah,
I will say the benefits of activity trackers, or let's say, for example, a watch, it does remind you to get up
right,
if you've
right.
been sitting for a while. I am a fan of those reminders if someone just doesn't feel well and they maybe need a little encouragement, and that encouragement could be their watch saying, "Hey, you've been sitting for a while. You got to get up."
Yeah,
So I think, like everything that dietitians say, in moderation. And what does that mean? It means having a healthy relationship, both with food and with these activity trackers. Like
yeah,
what is that data doing for you? Is it
right,
stressing you out? In that case, maybe that's not the path we want to go down. But if you're actually using it to as a light encouragement, I'm all for it.
right. Yeah, sometimes I find it helpful and it depends on the person just to kind of get a baseline when they're really not aware of how much they're moving throughout their day. Had clients who are just really active during their days and others that are not as active, but they're just really not sure. So sometimes it's helpful to kind of get a reading on, oh, like I'm getting 4,000 steps a day. So let me try to aim for 5,000. It gets tricky when it sort of becomes obsessive, and that's not the goal. The goal is just to like make small little changes based off of that. Something
I
that helps me personally because I find if I don't do my movement in the morning, it's harder for me to get motivated throughout my day to do more physical activity. But when I start my day with some, then I want to keep moving throughout my day. But on those days where I really haven't done so much or I've been sitting more than usual, I find that finding a 10-minute movement video or putting on music for 10 minutes and kind of having that, even 5 minutes, even just having
yeah.
that kind of as a gateway. Like I do it, I see how I feel, and then sometimes I decide, oh, like I want to keep going, or nope, I'm done, I'm good. It kind of helps me to just kind of set that small intention. It feels manageable than being like, I have to do this for 30 minutes.
Yeah. I call those the feel good workouts.
Hmm.
Where you're doing them just to literally feel good, like breaking up the stiffness type
Yeah,
of thing, where it's like 10 minutes just to move. And
yeah,
then you're like, oh, I actually feel better. And that could maybe lead to other things.
yeah,
Um, I wanted to comment on this before. So when you said like the smaller goals and just having smaller activity and these reminders,
yeah.
that's another time that I will use these activity trackers to encourage people to have these smaller goals increase over time to a bigger goal,
Yeah.
maybe like a survivorship 5K that they're
Hmm.
going to do with friends and family, where the bigger goal is to not only do more activity or more movement, but bigger in the sense of like more of the things that we're working on, like social connection, moving as appreciation that you can move and that you feel good now. That's what I mean by like it's a bigger goal where it's encompassing all of the other aspects that we've been working on as well.
Yeah, I love that. I love that. That's great.
Let's talk evidence-based guidelines. So we know the guidelines are 150 minutes per week of moderate activity.
Yep.
So we talked about light movement, maybe progression over time to get to that. What does 150 minutes per week look like?
Oh, that's where I take out my calculator.
Yeah, right. Wait, I think
That's
it,
like 5 days a week, 30 minutes, right?
yep, or I think like 20 minutes a day on average.
Yeah.
Give or take.
Yep. Yep. But again, I know that's moderate, not light, but you can kind of break it up.
For sure.
And honestly, even though that's a recommendation and I love the recommendations as baselines, I always try to meet people where they're at and just kind of put one foot in front of the other. And even if we're pushing a little bit more, every foot in front of the other is a positive one.
Yeah.
And just circling back to what you said before about the feel good workouts, I totally find that if we look for places where people are enjoying movements rather than dreading it, it is so much more sustainable. If you have
Yeah.
someone that hates walking on a treadmill, then like let's not walk on a treadmill. Let's
Yeah.
find something you actually like to keep it going.
Yeah. It's funny you say that because I often ask that to my clients. I'm like, okay, what do you do for physical activity? And then I follow it up with, do you like that?
Right.
And
Yeah.
the
Yeah.
amount of times we probably hear no,
Right.
but I have to. And I'm like, who says you have to? Like, we can find something else. What about dancing?
Right.
What about, and oh, there's a whole bunch of research on dancing.
Yeah.
That's a whole nother thing that we can talk about. But I'm like, what about dancing? What about, again, socializing with friends and going and doing something that's movement that's fun? I think I even recommended like going and doing axe throwing once because the person
Ooh.
was cleared. Yeah. And I was like, that's activity. You're
Yeah.
lifting something over your head and you're throwing it at the wall. I'm like,
Yeah,
that
it's a good way to
counts.
get out aggression too, I feel like.
Yeah.
Like it really helps with so many things. I love that.
I feel like it's therapeutic too. So I'm like, these are things that we, as you said before, we overlook what movement is because we might have this idea in our head that it has to be structured and planned and it has to be a class.
Hmm.
And we forget about bringing the joy into
The
movement.
joy, the
And
joy, the joy. The socialization aspect too, finding someone virtually, like having a phone call date with someone while walking or
oh
in
yeah,
person, is really, really wonderful. And it makes you more accountable too, because if you know they're meeting you or expecting your phone call, you're more likely to do it rather than push it off. So sometimes finding a buddy is helpful too.
yeah, walking meetings. I
Yeah.
hope if anyone is listening who's a manager or a leader in an organization, like please encourage walking meetings for everyone.
Yeah.
Um, yeah, doing things, walking and connecting at the same time
Yeah.
is great. So what are some key takeaways? What's forefront of your mind, key takeaway? Go, let's popcorn.
Movement of any kind counts and is helpful.
Yep. I would say movement doesn't need to be perfect or intense.
Yeah.
Um,
There's just profound benefits at every stage throughout the cancer continuum. Movement helps with detoxification through promoting bowel movements, helps with detoxification through sweating if it's more intense, and also helps. I know we didn't talk so much about this, but it does also help with hormone balance, like can lower cortisol or stress hormone levels, especially if you're outside and get that sun exposure, but also just through the impact that raising serotonin or happy hormones
yep.
has. It also can lower estrogen levels, which many people have estrogen levels that may be higher. So lowering them to more normal levels is also helpful.
Absolutely. I'm going to piggyback off of that and I'm going to say other benefits of movement in general. We know that the lymphatic system actually benefits from
Hmm.
muscle contraction and movement. So,
Yeah.
in terms of lymphedema, you do need to work with lymphedema specialists. But movement at the most basic level is encouraged. When what that means has to be cleared by other professionals within your care team. Something we didn't touch on is movement also increases confidence in your body. It could be for the way your body looks. It could also be for what your body can do.
Yeah.
And, my background is also in nutritional neuroscience, but the science behind cutting through negative thoughts by approaching things with gratitude. So instead of saying, oh, my body is not where it was before treatment, saying, my body is where it is right now after treatment, and I am so proud of it.
Yeah. Yeah.
Whatever that means
I
or
think
whatever
also there's a
movement it is.
degree of like body distrust after cancer diagnosis.
That's a great
So
point.
relearning how to trust your body and feel good about it and being amazed by what it can do is really meaningful.
Yeah. I mean, how often do we hear? I think the one thing that's recommended not to say to most cancer survivors is, oh, you're so strong,
Yeah.
because you're so strong. As non-cancer survivors, we may say it, but to the person, it might be like, well, I don't feel strong.
Hmm.
And encouraging movement, no matter what it means, could help them to feel that way, to feel a little bit stronger in whatever they're doing and a little bit more confident in those movements.
Yeah.
Yeah. But going back to muscular benefits, again, we want to work those muscles as much as possible. Muscles also mean your gastrointestinal tract or your GI tract. So, coming from, the GI hepatopancreatobiliary dietitian here, especially after surgery, we want movement before, right after, and farther after. We want movement as much as possible because the more that we move our bodies, the more that we move things along on the inside, and that ties into the detoxification too. But it also just goes into muscle integrity. We forget our intestines are muscles and they
Yeah.
have to be worked.
Yeah. Yeah. You don't
Um,
move it, you lose it. So for sure.
Yes, yes. And that goes into why we want to get some nutrition by the gut as soon as possible after surgery, too, because we need to work those muscles in addition to actually moving other muscles.
Yeah. And that's a newer recommendation. I feel like after surgery, there used to be more caution about feeding people, but it is important to kind of get them eating and drinking as soon as possible.
Using the gut as much as possible. Yep, because they're muscles. So I
Mhm.
think the overarching theme here is use the muscles, right? Like
Yeah, in
whatever
any
that means.
capacity, in
Yes,
any
however you
capacity, and
can.
make it fun. I know
Yeah,
we were talking about lymphedema too in the lymphatic system. And obviously making sure things are medically appropriate is key.
for sure.
But I've read also about some of the benefits of rebounding movement for the lymphatic system. And so that's like jumping on a trampoline, and they make those mini ones that it really can
Mm.
help move the lymphatic system along in a positive way throughout the body to flush it. And that's fun. I think that's fun. I love
Yeah,
trampolines. Mhm.
absolutely. That is fun.
Yeah. And they make
Feel
those
like,
little ones that aren't too expensive that you could even do in your house. So, yeah.
yeah, feel like a
Mhm.
little kid. And I'm sure you don't have to do that for like an hour. You could
No,
literally do that
no,
for
you could
like,
do it during commercials or something, or
yeah,
when a new Netflix episode comes up. Hmm.
yeah. Okay. I love that. So overall, the guidelines state 150 minutes per week, but that could mean different things for different people. And we both agree that any movement is beneficial, no matter what
Yeah.
stage in the cancer continuum. Make it fun, make it joyful, make it sustainable. Consistency, I would also say, is key.
Yes. Yes. And that's where setting realistic goals, I think, comes in, and setting things that you enjoy. Hmm.
Absolutely. Working with your care team to make sure that the movements that you are doing are appropriate and safe. I'd say that's another key takeaway. And then, any final thoughts?
The only other thing that I wanted to kind of pick your brain about is, do you have any recommendations on how to fuel your body properly for movement? Since we're coming from the nutrition perspective, this is a common question that I get not only from people dealing with cancer, but just people in general. Like, what's the best way to fuel? What's the deal with protein and
Oh, yeah.
movements? What's up with all this? What's the deal with creatine? We can probably do a whole episode on it.
Yep.
But what do I do? Mhm.
Oh gosh. Okay. Nutrition for physical activity definitely depends on the stage, I would say. So if we're talking about like before treatment and maybe even after treatment, I would say higher protein. Well, actually, no, higher protein would be throughout. But oh my goodness, before and after, well balanced carbs, fat, protein. We need all of it. Diverse, get vitamins and minerals, lots of fiber. The reason why my gears are turning right now is because from a
Yeah,
GI standpoint, I'm like, can they tolerate it? I'm like, it's
I
so
know.
individualized. So like,
It
okay,
is.
this is my final thought on this. Then I'm gonna kick it to you. Getting enough. And that means
Mhm.
different things for different people, but get
So
enough
true.
work with a dietitian because it is so individualized and
Yeah.
one diet or way of eating does not fit all.
Yeah. Yeah, no, I so agree with that. And everybody's shape and size is different. So like what you need is
Yes.
not what your neighbor or friend needs. One thing I think we mentioned in another episode that I do not think a lot of people realize is that the primary fuel for muscles are carbohydrates, not
Yes.
protein, carbohydrates. So I know that there is a myth that sugar feeds cancer, but getting the proper kinds of carbohydrates regularly is so important for giving your body energy and your muscles energy to optimize their function. So when I say optimal kinds of carbohydrates, as long as you're medically cleared to eat fiber, fiber-rich carbohydrates, I think, are most optimal most times. Doesn't mean you're supposed to do that 100% because that's also not healthy. But fiber rich carbohydrates include things like beans and legumes. So that includes like chickpeas and lentils and black beans. It includes whole grains and tubers like sweet potatoes and all that good stuff, fruits. So we definitely want to make sure you're getting steady carbohydrates throughout the day. And then after movement, that's when having a little bit of carbohydrates and a little bit of protein is helpful.
Yeah.
Um, in terms of like supplements, we have to do food first. Food is first. You
Very good.
can't build a house without the bricks.
Yes.
But there are some studies also on things to build muscle more efficiently, like creatine. And there's newer studies coming out about the benefits of creatine for cancer survivors in terms of maintaining muscle.
Yeah.
So again, we could probably do a whole episode on that and who it's appropriate for and who it's not, but that's another thing just to keep
Yep.
it.
And I do want to add to that because I think a lot of people, like you said, aren't aware of the fact that for muscles, it needs glucose. That's the primary source of fuel. And when we don't consume carbohydrates and our muscles can't get enough glucose, that there's something called the Cori cycle, where lactate will build up. The lactate then goes to the muscle to generate glucose and then go back to the muscle. So it's just making our body work harder.
Right. And not in a
To,
good way because lactate, isn't it related to lactic acid, which gives you that burn? So like you
correct.
can't do as much.
Yep.
So it's inefficient. So you're working harder, but not in a good way.
Yes, exactly. It's our body's like, you could just give us some carbs
Mm-hmm.
and we could be hanging out and doing all the work that we need to.
Yeah,
It's not as simple as that because there are many
sure.
metabolic processes, but it just goes back to the point of like, we need to eat enough, and that includes enough carbohydrates.
Yeah. Yeah. And I think that's also key for injury prevention as
Oh,
well.
yes.
Because
Preach.
if your body's working more inefficiently, then you're more prone to injuries. So yeah. Yay, dietitians for helping with all this.
Yes.
Yeah.
Absolutely.
Hmm.
Okay, so overall, for our listeners, thank you for tuning in. We are the One Podcast. It is your trusted home for evidence-based nutrition information with your oncology nutrition experts. We give you information, we give you facts, laughs, and with a whole lot of heart because we see you as a person first. If you have any questions, please reach out to us. And it was so great speaking with you today, Hillary.
Yeah,
And
you
in our
too.
next episode, we're going to be talking about pancreatic enzymes,
Woo,
which
yay.
is one of my favorite topics. I
Yeah,
joke
I
with
think it's
everyone.
so important, and so many people, including physicians, don't necessarily know how to optimize the dosing, and that makes an incredible difference for how someone feels and how they're absorbing their nutrients. So stay tuned.
Absolutely. And this is something that I work very closely with the people who I work with on
Yeah.
dosing, when to take the enzymes, how much to take with certain meals. So, yeah, we get into all of that in our next episode.
Can't wait.
Okay. Take care, everyone. Bye.
Bye.